was just touching 34 years in 1995. I started practicing breast self-examination, and it was during one of those examinations where I picked up my lump. I did the screening via an ultrasound of the breast and the mammogram, and true enough, it actually confirmed that there was a lump. The biopsy revealed that there were cancer cells, and so I was advised to have further surgery. So it was more of my family that actually I relied on for support. I decided to have a mastectomy, that is the removal of the whole breast. And followed by that surgery, I was advised to have chemotherapy, radiotherapy, and hormonal therapy. All women above at young age are encouraged to do breast self-examination so that we would be the first to identify any abnormality and then go on to have it screened. Dr. Dalila will be able to share more in detail on that.
As explained before by Adeline just now, that the topmost cancers among ladies in Malaysia are breast cancer. About 30% of those cancers affecting the women in Malaysia are breast cancer, followed by the colorectal cancer, and thirdly is cervical cancer. Now, 1 in 4 Malaysians will have a risk factor of having a cancer in their lifetime. Almost 60% of those breast cancer that we found in Malaysia are found at later stages, which are at stage 3 and 4. Early detection is quite low in Malaysia, or it's also one of the reasons is because knowledge. Although the knowledge of cancers are slowly rising up in Malaysia, but still it is not being translated into action. Because when you come screening early, you detect it early, and then your treatment for your cancer is much lesser, not as aggressive as those in later stages where you need to take the whole breast out, and of course the treatment are also going to be more pronounced.
Talking about cancer is quite sentimental to me. You know why? Because of my late mother also was diagnosed with breast cancer in 1999, and during that time with, I think, compared to nowadays, the technological advancement is not there yet, and based on that experience, I think saya boleh rumuskan apa yang saya tengok sendiri with my own eyes. It always I always call it 2F. The first one is the family support. The second one is the financial support. So that is why I think a collaboration between a few organizations, a few institutions must be continued, and especially for today, right? FWD Takaful with National Cancer Society of Malaysia. I think this need to be continued, and we have to always have this kind of collaboration. For the one purpose is to increase and bring up the awareness to the public.